Rudro. So, look, the thing is that first of all, we have to understand a basic overview regarding the thyroid gland. The thyroid gland is like uh, there is a thyroid gland that basically lies just in front of the neck. Okay, so this thyroid gland basically produce T3 and T4, these two hormones. But this thyroid gland is basically acting by the influence of the TSH, and that TSH is going to be secreted from the anterior pituitary. And the release of the TSH from the anterior pituitary again is going to be controlled by the thyroid releasing hormone, TRH, right? And that is again secreted from where? Hypothalamus. It is our basic undergraduate knowledge, right? And obviously there is a feedback mechanism and the negative feedback inhibition is there and all. Okay. So today we are here to discuss regarding the hypothyroidism. So hypothyroidism is basically traditionally defined as a deficiency of the thyroid hormone production from the thyroid gland. Okay, so the prevalence basically lies around 0.1 to 2%, uh, and your hypothyroidism is a basically 5 to 8 times more common in case of women than that of the men. Okay, so this is basically much more prevalent in case of female patients. So there is like the primary, secondary, and the peripheral causes of the same. So look, the primary cause is like the disease or like the problem somewhere in the west, in the gland itself, in the thyroid gland itself. Okay. Then comes the secondary, which is basically the pathology lies in the head. So the pathology lies in the pituitary or somewhere in the hypothalamus region. And in the periphery, there is a problem like the thyroid hormone where they basically going to work. The problem basically lies in that level. Okay. So in our primary causes, first of all, we have to understand like obviously iodine is basically needed to produce thyroid hormone, right? So iodine is basically what is a raw material. Now, if the raw material is not present in the body or not presented through the diet, and this iodine is basically taken through the diet, right? So if it is like less in number in the diet, they are going to be cause hypothyroidism. It is as simple as that. And in most worldwide, iodine deficiency uh, is the one of the leading cause of the thyroid or leading cause of the hypothyroidism, even in case of India as well. But there is another set of the disease which is known as the autoimmune disease, also known as the Hashimoto's thyroiditis. So there is a destruction of the thyroid gland itself. Okay, so there is a destruction of the thyroid gland itself. So this is known as the Hashimoto's thyroiditis. Also, there is a some examples or some causes are like the surgical or radiotherapy related hypothyroidism means there is some pathology in the thyroid gland and you ask your surgeon friend to remove that gland, and after removing that gland or after having a radioiodine ablation therapy, so then the patient will comes to you with a hypothyroidism, right? Okay. Now the medication. Also, there are a few medication that is basically involves in causing hypothyroidism. Number one is your TKI, the tyrosine kinase inhibitor. They are basically associated with that, and then comes your lithium, right? So the secondary causes you have the tumor, which is basically either your pituitary tumor, or there is a craniopharyngioma, or sometimes the meningioma, which is basically like cut off the connection of the pituitary stalk. Also, there is a trauma either due to the head injury, sometimes surgery, or irradiation that is also going to cause some problem at that level. Also, there are like the toxoplasmosis, syphilis, and the tuberculosis abscess formation has been seen to be caused secondary hypothyroidism. Also, there are infiltrative disorder like the hemochromatosis, histiocytosis, and the sarcoids. These are also there. And this kind of disorders are also basically uh, going to infiltrate the pituitary or the hypothalamus gland, and that is what they are going to associate with the decreased production. Also, there is a chronic lymphocytic hypophysitis, and a few drugs like the dopamine and the glucocorticoids, they are also associated with the same. In case of peripheral cause, you have to understand consumptive hypothyroidism is the one. Why? Because let's suppose there is a hemangioma. Okay, hemangioma is basically a benign tumor which is basically made up of blood vessels, right? So if there is a massive infantile hemangioma, what happens? There is a consumption hypothyroidism. Meaning all the thyroid hormones are basically consumed in that hemangioma as well. And the same thing is basically happening with the coagulopathy as well, like which is known as the consumptive coagulopathy, also known as the Kasabach-Merit syndrome, which has been seen typically with a liver hemangioma, giant liver hemangioma. Then comes your mutation in the genes that has bbeen encoding for the MCTP or like a TR alpha or TR